Hi there, I'm Kim Stevens here in the FOX26 Newsroom, and we are talking today about issues that affect both men and women, but specifically women. And it's not just when or after a woman gives birth, but that is one of the big issues, and that has to do with our pelvic, our pelvic health. You know, after we've been carrying a baby and our whole body is changed, this area starts to go through it's gone through kind of a traumatic situation. But then also, as we get older, the same thing can happen. And if your pelvis is out of whack in any way, the rest of your body is too. So let's go to a doctorate with physical therapy, Elizabeth Maskell, with a community medical group, to give us some insight and hopefully some relief for anybody who is having some pelvic pain. Good morning, Elizabeth. Thanks a lot for being with us today.
Yeah, good morning. Thanks for having me. I appreciate it.
I do have to tell our viewers that you and I have tried meeting a number of times, and one of the reasons why we've had some challenges aside from technology is because you are so busy. You told me that you are scheduled out almost like what, a year?
Yeah, I'm scheduled out about a year. Mm-hmm.
That shows to me then that pelvic health is a real broad issue affecting a lot of people, and I didn't realize that. So explain to me what you do with people with their pelvic floor.
So pelvic health, I want to say, maybe in the last 10 years has really been kind of like a hot topic that has been talked about more. Pelvic health physical therapy has been around for probably 30, 40 years, if not more. But over the last 10 years, I think with social media and things like that, it has become a lot more of like a hot topic, and people know about it and they know to ask for it. And so what I do is I help people either regain strength or loosen up their muscles in the pelvic floor, because the pelvic floor acts like a hammock that supports your pelvic organs. So your bladder, your uterus, your rectum, or the prostate if you're a male. So it helps support all of those organs. And either injury or after having children, a fall on the tailbone, anything like that, even a job where you've been heavy lifting all your life, those muscles can get either really, really tight and then they're really inefficient, or they can be really loose and they're not working that way. And so you can have leaking, you can have constipation, you can have pelvic pain, so many different things. And so I help with all of that. And then like pelvis alignment, if you have a fall and you're kind of stuck in a rotation, now your muscles are at a pull on one side and lengthened on the other. So again, they're inefficient. So they don't work and they don't support your organs.
How do you know if you need to go see someone like you who specializes in this? I mean, you said leakage. I think we could probably figure that out.
Yeah.
Or is it a pain in a certain area that we would know?
So it can be like a deep sitting pain, like deep in your sitting bone where you can't like pinpoint it, so you can't like touch it. So it's like deep inside. It can be pain with like intercourse, or pain with having a bowel movement, pain with urinating. Any of those things are usually kind of telltale signs, or even like just a low kind of ache through here can be part of it as well. Because your organs are all right there. So that can be a big part of it. And that's kind of your telltale sign that something's not right. But leaking is not normal no matter what. Like, even if you just had a baby, you should not leak when you cough, laugh, or sneeze, or jump. You should be able to do those things. It's common, but it is not normal. And I can definitely help with that.
I think a lot of advertisements make us feel like, you just deal with it, because you say it's so much more normal or talked about maybe.
Yes. Yeah. I mean, they have commercials, for these underwear. Leaking is just part of being a woman, and wear these pretty leak-proof underwear. But I mean, they're great. They're marketing at that, but you shouldn't have to leak, and you shouldn't have to wear those underwear. There's things that you can do to not need that stuff.
Okay, very good. So what are the solutions to any of these issues?
So, I mean, it depends on what's going on. So if you had any kind of abdominal surgery, like a C-section, an appendectomy, you had your gallbladder taken out, scar tissue can bind down in there. And so we do a lot of work on loosening that up because that can pull at your pelvic floor muscles. And we think because we didn't have a baby like vaginally, so a baby didn't come out of our vagina, that my pelvic floor muscles are spared, but that is not the case. That C-section scar, if you're kind of looking at a model right here, a C-section is right here and our pelvic floor muscles are right here. And so bladder and uterus are here. So it's very, very close. And when they do a C-section, it's not a quick, like, let me cut through this. They cut through 7 different layers of tissue. So they cut through your skin, they cut through your fat, they cut through your fascia. So that's our next layer there. They pull your muscles apart here. And then into the peritoneum, they pull your bladder out of the way, and then they cut into your uterus as well and into the amniotic sac. So they cut 7 different layers of tissue. It's a major surgery. And so when they do that, we don't just like sew one layer, sew the next layer, sew the next layer. They kind of bring it all back and kind of bunch it up. And so it's really easy for that to bind down towards that pelvic floor, or bind down to like other organs or other tissue like the abdominal wall or something like that, and start to cause pain. And then that can make those muscles really inefficient as well, which can cause us to leak. And so we work a lot on scars. It can be fresh. It can be 8 weeks postpartum or post-op, or it can be 10 years or 20 years. Like that scar can bind down and we can work on it. And I think too, if we have a surgery when we're a child, like an appendectomy at 7 years old, our body has now grown to this scar that is bound down right here. And so that's probably going to need some work because that's going to be affecting things. And that can definitely affect pelvic pain, but it can also affect constipation because your intestines are right there and you have something kind of bound and pulling at things all your life. Mm-hmm. And so a lot of scar work, a lot of manual work.
When you say work on it, what are you doing? Are you like giving like a really deep Rolfing type massage or what?
Kind of. It's as if the line was like this, I'm kind of pulling at the tissue and finding where it's tight so that it's not so bound down and kind of freeing it up. So if like the fibers are kind of all over the place, you want to kind of smooth them out so that they can stretch a little bit versus being like haywire in there. And so you're helping realign that tissue so that it has some lengthening properties versus just being like this ball that's adhered and stuck in there. So it's not necessarily, it breaks up scar tissue a little bit, and it is like it's a firm like massage, but I wouldn't say it's like this huge, deep, like full body massage. It's specific to that area or where you find that it's tight. Sometimes we kind of pull it in one direction and then kind of pull it the other direction to stretch that tissue so it moves instead of being adhered down. And so
it does. You have made me feel good for people who have had situations or surgeries, I mean, years ago, that there is relief years after there is something that can be done.
Yes. Yeah. It doesn't have to be recent. I mean, it helps. It'll go a heck of a lot quicker if we see it fresh. But if it's 10, 20, 30 years down the line, there's still work that can be done. Like it's not I've come too far and I'm just stuck like this forever. There's definitely work.
How often? Every body is different. Every situation is different. But what is a generalized idea of how long a treatment like this would last?
So if it's something that's, relatively acute, happened within the last year or two, I would say sometimes we can get away with 4 to 6 visits and you're good to go. If it's something that's been 20, 30 years of chronicity, it might take us 12 to 18 visits. And I usually see people once a week or every other week for about 45 minutes a visit. And so
but you're jam-packed. Your schedule is jam-packed. Are there a lot of other physical therapists who specialize in pelvic floor health?
Not here in the Valley. There are all over the nation, but in the Valley, there's a handful of us here that see patients. I mean, we have over 1 million people in Fresno County, and so we have maybe 5 therapists that do this, and so it's we're definitely outnumbered. I'm the only one that takes insurance, so most other people are cash pay, which limits the population they can see. So that also has made my wait list jump up. It used to be like 6 months and now it's a year when some other clinics went cash pay, but it is what it is. But I do offer, and I think we all kind of are, we've collaborated together. I've talked to all the other pelvic floor therapists or most of them. And our goal is to like be able to help our community. And so like I offer free Zoom classes once a month for birth prep and postpartum classes, because at least I can reach a target that might be a year before they get in, but they're on the right track, right? Instead of doing all the wrong things or not knowing what to do. And now at least in that first year, you're on the right track, and maybe you may not need physical therapy at that point because you've done all the right things, or maybe you do and you'll need 1 or 2 visits at that point because now it's just fine tuning or tweaking things. And so just educating people about pelvic health. There's a lot of social media stuff that talks about pelvic health. There's pelvic floor therapists that give a lot of good education, and some classes you have to pay for them, but a lot of them is just free education, because we really want to get the word out to teach you what is normal, what's not normal, and what you can do to help yourself, because we are kind of outnumbered.
Yeah. What about taboo in this area? I mean, it seems like we had talked about before, the commercials now about, underwear and such for leakage on TV. We see that a lot more commonly, but still I suspect a lot of people keep this in a private shame area.
Yeah, it's not something you talk to your girlfriends about of like, oh, hey, I, just walked upstairs and I peed my pants. But I do have to say, I think that with the commercials of having like leaking is normal for being part of a woman, even having like menstrual cycle, like pads and things like that, those commercials are a lot more like widely on than they used to be. It used to be like those things weren't on until after like 9 p.m.
Right.
And now they're on all the time. So I think it has become more talked about, and it's not as taboo. There's definitely generational where it's still taboo in certain generations or in certain cultures. But I would say most of like what's going on now, like a lot of people have no problem talking about it. I still think there's definitely some taboo about it. You don't talk about like, oh, I feel like my bladder just fell out of my vagina, or I have this ball hanging out if there's pelvic organ prolapse. But once you do say something to somebody, then it's like, oh yeah, I had this too. Oh, I had this too. And like, then you have this group of people that you can talk with. But I don't know how to not make it taboo. I mean, there are common things that happen. We deliver a child, but like I said, I think social media has been a big help because it is talked about a lot more. Mm-hmm. And I know that it kind of streams things based on what you look at. So my social media consists of all pelvic health stuff. But I think if you're curious about it and you do look at it, I mean, that's one nice thing about that. Then more things will pop up and you'll realize you're not the only person going through this.
Can we find you on social, which would also help us find those free Zoom classes by just putting your name into either Facebook or Instagram?
Maybe. I have a social media. I use Pelvic Nation. Okay. Is what I do. And I work full time in here, so I don't create a whole bunch of my own content, but I share like good information with other people. Because there are a lot of floor therapists that like social media. They have a media team that does a lot of their social media work for them, and I don't have that, nor do I care about it. But I will share good information because there's a lot of bogus information out there as well, and then you don't know what's accurate and what's not, and people can say they have credentials and not have credentials.
All right, so let's go to something bogus. Let's say if there are 3 things that you see consistently that are wrong, what would be one of them?
Kegels while you're peeing. Peeing is normal after having a baby. And that needing to wear pads or incontinence underwear is a normal thing after like 50. Those are all 3 bogus things that are not true.
Okay, thank you.
Yeah.
Now, what are some of the symptoms that people have, feelings that they have, that they will know they need to see a pelvic floor therapist, physical therapist?
If they have heaviness or feel like there's a ball coming out of their vagina or like heaviness in their vagina, that's one. If they are leaking with coughing, laughing, sneezing, or jumping, or even have to like cross their legs when they sneeze, okay. That's another one. And then if you have pain with intercourse, I see your OBGYN first and rule things out, but otherwise seeing a pelvic floor therapist, those are not normal, and you should never have pain with intercourse.
Okay.
So that's a big one, especially if you have always had pain, you think that's your norm, and it shouldn't be.
Wow.
Yeah.
I hope that I suspect that you've opened up the eyes to so many people who are watching this, and maybe hopefully given people some understanding that there's nothing wrong with you.
No, there's nothing wrong. It's common things, and they happen, and we can definitely do things to help it and make that go away, because you shouldn't have to live with that stuff.
Great. Any last thing you'd like to say to our viewers today?
I would say if you're pregnant or thinking about being pregnant, talk to your physician about even like getting information on pelvic health, or coming to Community's website, and you can find where those classes are offered, because you get a lot of good information of what to do during your pregnancy and then what to do postpartum, because that's probably the easiest way to start, because you're starting fresh. And so you're starting with all the same basic things, and we just don't get that information.
Okay. And what about when we're on the opposite side of our biological spectrum, going through the change of life?
That with that change, with like menopause and things like that, vaginal dryness is a really common thing, but there are things that can help, and you shouldn't have leaking with that stuff either, or pain with that stuff either. So there's more natural ways, or there's healthy ways where you can help yourself. It's not just having to rely on medication. Sometimes it is, but not always, and there's other things that you can do.
Okay. Elizabeth Maskell, a doctorate with physical therapy for specializing in pelvic floor health. Thank you so much for your help, your guidance, and your understanding today. Much appreciated.
Thank you so much for having me. I'm really glad I can get this topic out and hopefully make it less taboo.
Thank you. Have a great day.
You too. Bye.
Hi, I'm Monty Torres with FOX26 News on YouTube. Thank you for checking out our YouTube channel, where we have loads of great content for you to choose from. And while you're here, why not click on the subscribe button right here? That way you can stay in touch with all the latest breaking news, everything news related within the Central Valley. And thank you for watching.